7% increase in training since the previous year. This continues a positive trend of more robust CPR education, and the 2023 figure represents a more than 800% increase since 2021. It was also a strong year for smoke alarm installations performed by the department. In partnership with the American Red Cross, we installed nearly 22,000 alarms, which was a 50% increase from 2022. Through this voluntary program, which is conducted at no cost to the resident, we visited approximately 7,600 homes, which is an increase of 42%. I invite all the council members here today to follow up with the FDNY Community Affairs Unit after this hearing. We would love to schedule education events and alarm distributions for your constituents. FDNY youth programs had their most successful year to date. In June, we launched the FDNY Fire Cadet Program, and cadets are now on their third rotation, receiving a well-rounded introduction to the department. We certified 111 young men and women from our Youth EMS Academy as New York State Emergency Management Technicians, which brings the total number of alumni certified through our programs to 599. Of those who were certified in 2023, 94% filed for the civil service exam to become FDNY EMTs. Youth Academy alumni were hired as EMTs and as FDNY cadets, making 2023 the year with the highest number of alumni being hired by the department. The FDNY Captain Vernon A. Richard High School had a graduation rate of 93% last year, which was higher than both the borough-wide and citywide averages. We also continued our successful FDNY Exploring program. Across 8 Explorers posts, FDNY Explorers completed nearly 600 hours of community service at 55 different events. We honored the legacy of departed members in 2023. To cite just a few examples, we renamed the FDNY Headquarters Auditorium after the department's first Black Fire Commissioner, Robert Lowry. We hosted a plaque dedication and street renaming in honor of EMS Captain Allison Russo. We also released a public service announcement and messaging to encourage organ donation in honor of firefighter Billy Moon, who donated his liver, heart, lungs, and kidneys so that 5 others may live. The legacies of all 3 live on as heroic examples of our FDNY family. Another highlight of the last year was FDNY members using innovative technology to carry out significant life-saving operations. In April, after the partial collapse of a parking garage in the financial district, the FDNY robotics unit used a robot Dalmatian to survey the wreckage and assist with searches. In July, Manhattan fire companies were dispatched to a high-rise building that was under construction in response to a crane on fire. The FDNY robotics unit used drones to provide eyes in the sky, coordinating hose streams and enabling engine and ladder companies to evacuate tenants, extinguish the fire, and assess structural damage. In December, after a 7-story building collapsed in the Morris Heights section of the Bronx, FDNY units arrived on scene within 90 seconds. After occupants of the building were moved out of harm's way, the FDNY robotics unit incorporated the use of drones along with first responders and trained dogs to search for potential patients in need of aid. Together, they spent hours combing through a massive pile of debris, ensuring that no victims were left behind. Ultimately, we were very fortunate to confirm that despite the magnitude of the collapse, there were no fatalities. Of course, time-tested technology continues to be instrumental to our life-saving mission as well. I took a great deal of pride a few weeks ago when members of Ladder 28, Squad 41, and Rescue 3 performed 3 daring rope rescues at a fire in Harlem. Among the courageous individuals who went over the side of the building to rescue individuals hanging from windows was Jason Lopez, a probationary firefighter who has less than a year of service. He is a true example of the difference that each member of the FDNY can make, from the most experienced member of a company to the probie who only has a few months in the firehouse. The fire in Harlem was caused by a lithium-ion battery for an e-bike. 2023 was a challenging year for the fire department with regard to the frequency of lithium-ion battery fires. The number of fires caused by batteries for micromobility devices, such as e-bikes and e-scooters, increased to 268 in 2023. As we've previously described to the council, these fires are tremendously destructive. 150 people were injured in lithium-ion battery fires, and 18 people were killed. It's a problem that is plaguing the city. Though not prevalent on Staten Island, these fires occurred in significant numbers across the remaining 4 boroughs. The council has been a great partner as we work to combat this crisis. Last year, we passed a package of bills aimed at creating rules and safeguards for e-bike use in the city. Together, we prohibited the sale and rental of uncertified devices, and we restricted the assembly and reconditioning of second-use batteries. We developed a comprehensive public education campaign and then worked with our fellow agencies, such as the Department of Consumer and Workforce Protection and the Department of Transportation, to perform outreach to e-bike retailers and consumers, including online retailers. Our partnership has continued this year with the council recently passing legislation that granted the fire department cross-enforcement ability, enhancing the penalties for repeat offenders, and requiring stores that sell e-bikes, e-scooters, and other personal mobility devices to post safety materials and information guides. We are grateful for the attention paid to the issue by this committee, and in particular to Chair Ariola for your ongoing advocacy. Turning to the budget, the department's fiscal year 25 budget is $2.53 billion. This includes $2.28 billion in personal services and $241 million in OTPS. Our fiscal year 25 budgeted full-time headcount is 16,984. Our fiscal year 25 capital budget is $216 million. Our 10-year capital budget from FY24 to FY33 is $1.9 billion. We were fortunate enough to have two of our PEGs, the program to eliminate the gap, from November reversed in January by the mayor. 5th firefighter staffing on 20 engines was restored, as was the LSS long-term disability termination PEG. In the mayor's preliminary budget, the department received funding in FY24 to replace the 5 EMS units that were previously being operated by Beth Israel Hospital. Beth Israel has stopped running those units, and as a result of this funding, residents of the area served by those units will not experience any decrease in service. We also received new needs funding to cover PS deficits for EMS and civilian members of the department, as well as OTPS funding to cover structural deficits, primarily in the area of auto parts for FDNY fleet services. This will enable the department to continue making necessary purchases to keep trucks, ambulances, and other FDNY apparatus on the road. With the support of Mayor Adams and the City Council, we look forward to another strong year ahead. This time, I would be happy to take your questions.
Thank you so much, Commissioner. We're going to go a bit out of order right now. I'd like to ask our public advocate to make his opening statement. Thank you.
Thank you very much, Madam Chair. As mentioned, my name is Jamani Williams. I'm a public advocate, City of New York. Thank you, Chair Ariola, and members of the Committee on Fire and Emergency Management for holding this hearing and for allowing me to share a statement. Thank you, Commissioner and team, for being here. Fire safety is a top concern for New Yorkers. The prelim Mayor's Management Report states that there have been 102 civilian fire fatalities in this fiscal year, which means a civilian death once every 3 days. Very sharp increase from the last 2 fiscal years, with 64 civilian fatalities in fiscal year 21. Fire safety is a public safety concern. I appreciate that the mayor has acknowledged it during the prelim for fiscal year 2025 by exempting the FDNY from additional PEGs. Of course, there still needs to be a stem in the trend of fire deaths. Under the prelim budget for fiscal year 2025, Mayor's office's budget added a 5th firefighter to 20 companies. Very much support the increase in 5th firefighter and applaud the Adams administration for supporting fire safety. However, this means that only about 10% of engine companies will have 5 firefighters, or 20 out of 193 engine companies, and it just restored an extremely recent December 2023 cut. It's less of a positive change and more of putting out a fire that you started yourself, which in and of itself would be a return to the broken status quo. I agree and stand in support of the Uniform Firefighter Association's calls for a 5th firefighters. Part of the growth in civilian deaths from fires can be attributed to lithium-ion batteries. Lithium-ion batteries are difficult to contain, and the fire can spread very quickly, putting civilians and firefighters in danger. Fire Commissioner Kavanaugh announced that lithium batteries are now a leading cause of fires. Everyone agrees and acknowledges how lithium-ion fire batteries are a significant challenge for New Yorkers, and thankfully this council has passed some legislation such as restricting reconditioned batteries. We, of course, must continue to look ahead. The micromobility devices usage and lithium-ion batteries will only become more commonplace. One of the easiest ways to prevent lithium-ion battery fires at the source is using a fire-retardant storage case for storing lithium-ion batteries at home or in the office. They are relatively inexpensive, protect batteries during charging process when batteries are most vulnerable to overheating. Fire retardant bags can cost as little as $20. This relatively affordable investment will pay a huge dividend in decreasing the number of fires as well as saving lives and infrastructure. The Office of Public Advocate is recommending that the administration immediately put some money into purchasing these for free delivery. Research shows that about just for $1.3 million, you can get all 65,000 delivery workers a bag. For $500,000, you can get about 20,000. With the city's bulk purchasing power, we can probably get 65,000 just for 65,000 bags for just about 500,000. And that would be a great way to immediately try our best. This can be similar to what we did to giving out free smoke detectors and free battery distribution programs. Furthermore, delivery apps can mandate that drivers use and own certain equipment, such as possessing a fire retardant storage bag, in order to be able to make deliveries or provide them themselves. Others, often in government, we're forced to make hard decisions about whether the impact of a policy is worth the price tag. Here, though, we have a simple, cost-effective solution that will ultimately save money and, much more importantly, save lives. This does not solve the issue fully or forever, but it can have a real and immediate impact at a moment when this destruction is constantly on our streets and our screens. We urge the administration to fund this purchase and distribution without delay. In the long term, we must redesign New York City's infrastructure to accommodate micromobility devices. Devices help to transport New Yorkers who otherwise may use a car or use a gas-powered moped, as well as assist the disabled community. We must encourage wide-scale adoption through addressing outstanding safety concerns. It is now common in South and East Asian countries to see battery swap stations where e-bike owners can pay a monthly subscription to swap a dead battery for a fully charged battery, so they do not have to charge the device at home. Cities should consider creating a franchise agreement for a battery swap system with singular battery standard, as we have similar infrastructure in the form of the city bike system. Delivery apps also have responsibility for supporting infrastructure for its delivery drivers. Companies offering 15-minute delivery local service like Gitter already provide charging stations to their drivers. The onus should be on delivery companies to set up charging stations for their drivers. And finally, the New York City Council Committee on Fire and Emergency Management has been doing an excellent job responding to lithium-ion battery safety concerns by passing comprehensive legislation. Hopefully the committee continues to make that legislation be enforced by holding oversight hearings to determine if it's being put into place. So thank you so much, Chair, and thank you so much, Commissioner. I know it's a tough job for the department as well.
Thank you so much to our public advocate. I'd also like to mention that we've been joined by Councilmember Carmen De La Rosa. Since we're on the topic of e-bikes, we'll start with e-bikes. How's that sound? Okay. So has the fire department identified any trends in where e-bike fires are occurring that could inform proactive inspections or outreach?
So we have, and I'm going to have our Chief Fire Marshal, Chief Flynn, speak specifically to the data, but do want to say one thing that's so important to this group, which is we've seen that our enforcement, supported by the council, is working. We're not seeing as many, or actually any, recently of these fires in commercial locations. We're seeing them all in residential locations, which is the one place we can't inspect, right? And so that really reinforces some of the outside-of-the-box thinking that the public advocate mentioned, and education and outreach events. So with that, I will hand it over to Chief Flynn to talk about exactly where we're seeing these fires still in the city.
Good morning, and thank you for having us, and thank you for your excellent question, Public Advocate. So just for a breakdown, in 2023 borough breakdown, we had 74 fires from lithium-ion batteries in the Bronx, 97 in Brooklyn, 47 in Manhattan, 48 in Queens, and 2 in Staten Island. So with the exception of the borough of Staten Island, they've been pretty well distributed throughout our city. Our hazmat units have tested several products to try to alleviate this problem. There are some promising products out there on the market. Some that we've tested have failed. So it's important to have that feedback and actually real-world testing on these products. We've partnered with our partners our federal partners in the CPSC, with UL Solutions, to try to figure out products that would be suitable for our city and protect the residents that already have these products. We've been in discussions with the delivery platforms to try to increase safety and increase education for their workers to make sure that they are safe and they understand these products that they use do pose some type of danger. As you mentioned, last year, calendar year 23, we had 106 fire fatalities in the city. That's a very high number, and it's very alarming to us. In 2020, we had 0 fire deaths related to lithium-ion batteries, 0. Last year we had 18. Scary situation. It's developing quickly. I hope at some point we plateau and we don't continue to increase. Our numbers have exponentially increased year over year since 2020. It's a problem that we're attacking from all angles. We're partnered with our sister city agencies, the DCWP. We go out on a daily basis. We have established a task force where we go out and inspect all of these locations that are selling these batteries to educate as well as conduct enforcement on locations that we see egregious violations. It is not our intention to hurt small business. We want to educate and make sure that these businesses are selling safe products and are engaged in safe practices. So, for example, last year we conducted 467 inspections specific to lithium-ion batteries. We issued 375 FDNY summonses, 816 violation categories were on those summonses, 229 violation orders, 46 criminal summonses, 33 referrals, and 16 vacate orders. We've even stepped up our efforts this year, so far conducting 143 total inspections with 147 summonses, 174 violation categories on those summonses, 46 violation orders, 5 criminal summonses, 17 referrals, and 4 vacate orders. We do that in conjunction with our partners in DCWP, NYPD, DOB. So this is a full effort from all agencies within the city. We want to thank them for their efforts and their assistance. We thank the council for the measures that they've enacted. I think they will make a difference. Local Law 39, I think, is an excellent step in the right direction. I've traveled with the commissioner over the last few months to DC several times to support federal legislation that was proposed by Councilman Torres, 1797, to put that to a vote and establish some type of a national standard. We can only limit so much here in the city. It's difficult to limit products that are coming into the city if they are legal to be sold right across our border. So the commissioner, I believe, traveled to Albany recently to support state legislation as well to curb the tide of these dangerous devices. So we are attacking this from all angles, and we appreciate the support of the council on this issue.
Thank you for that comprehensive response. And I want to acknowledge Councilmember Swang on Zoom. Okay, in keeping with e-bike, and you answered a lot of questions that we have here, so I really do appreciate that. So just what type of products have the FDNY been testing regarding bikes and batteries?
So we hold forums at Randall's Island, which is our training academy, and we've tested, as the chief mentioned, a number of products from bags to crates to different types of containers that would hope to contain one of these if they caught on fire, in addition to some suppression materials. As he said, we have a couple of things that are promising but have not haven't really proven to be fully fire safe. We have a number of things that sadly people have brought to us and have failed entirely, but we do have both the support of CPSC but also some funding from the Department of Homeland Security to continue to test these devices, because we do believe, especially when it comes to the delivery apps, that's one of the things that we want to make sure is required, that they have access to. I believe we will be having a number of these forums at the Academy in the future. We'd be happy to invite you guys so you can see what sorts of products are coming forward, what works and what doesn't. And then I also want to mention that we announced a couple weeks ago with the mayor's office and the Department of Transportation the outdoor charging stations, which does mimic what we see successfully in other countries. And we are very, very hopeful about that. Really for us, getting these outside is really 90% of the battle, right? They're really deadly when they're in an apartment. And I want to remind people that even when they aren't the cause of the fire, they're deadly. Think about being a firefighter and going down a hallway and hearing one of these erupt behind you, effectively trapping you in the apartment. So we really want to see a world in which we can get these outside of people's apartments, and so this pilot we think is very, very promising for doing that. We'll continue to test out more of both those outdoor stations and to really support that pilot, but also more of these bags and other things that once they actually are proven to work could be given out to the delivery workers or required of the delivery companies.
Thank you, Commissioner. So the council recently enacted legislation authorizing FDNY to conduct enforcement of local law which prohibits the sale, rental, or leasing of e-bikes, scooters, and batteries that do not have certified, accredited batteries from a laboratory. How does the FDNY intend to conduct these increased inspections relating to this new grant of authority? Does the FDNY enforce the sale? And how, with online realtors, realtors, and And does FDMY intend to enforce the certification requirements on establishments that rent and lease e-bikes?
Yeah, so we work with our partner agency, DCWP, to consistently be reviewing what's sold online, talking to the companies about taking off the uncertified products. I think as many of you have heard, we've also recently encountered people selling fake UL stickers on these sites, and we've tried to really aggressively approach that. I'll ask Chief Flint to also talk about what they're doing on the enforcement side, especially with the passage of that law and the expansion of that authority to us, which we appreciate very much.
Thank you. And then I want to talk about contaminants from those fires, because this is kind of new territory for us all. So we know that e-bikes and their batteries produce noxious fumes and chemical byproducts that can contaminate firefighter bunker gear and place firefighters at increased risk of illness. What protocols does the FDMY have in place to ensure firefighters are protected from the chemicals created during the e-bike fires? And how frequently are firefighters' bunker gears cleaned? And are there special protocols for the decontamination following an operation related to e-bike fires?
Yeah, we are very concerned about this as well, and I think it's worth saying that in addition to the e-bikes, a lot of what burns in a fire in 2024 is more toxic than it used to be, and so we have concerns for our members going to these fires with e-bikes, and we do both encourage making sure that people are fully encapsulated before they go into these fires, that they're donning and doffing their bunker gear correctly, and that they are deconning and washing their gear more often. We are also working with our national partners to make sure we actually study this, so trying to study the health of our firefighters, study what's on the gear when they come out of a fire like this. The marshals are actually pulling some of the information from the medical examiner for victims of e-bike fires to see what is actually in their system afterwards, to come at a number of ways of figuring out whether or not these additional chemicals do actually make their way into those who are at the fire, especially the members.
Yeah, it's very important. I just want to mention that we have council members Gennaro and Felice on Zoom as well. And I think I cut you off before. I don't know if you were going to chime in on the law that was recently enacted, for the...
That's the dual enforcement?
Yes, I wasn't sure that if I had cut you off with the, before
Yeah,
we went into
we
contamination.
really appreciate...
I'm sorry if I did.
I'm sorry. We appreciate enacting that dual enforcement power for us. I think it'll be helpful, but I don't want to take away from the efforts that DCWP has been conducting since September, when that law was able to be enforced. They have been out there with us every day conducting enforcement. I believe we've visited every location that we are aware of that are selling these devices. The dual enforcement helps, but it's not to take away from the efforts that DCWP has been conducting thus far. It would just allow us to also write violations related to the sale of non-certified batteries within the city.
All right, good. I think we're on the right track. We're on the right track. And we're all working together and listening to all of the, outside of the box kind of ideas that we have all put together, including the public advocates' ideas, which I'd love to share with you later because I thought they were very interesting and I think be very helpful. Thank you. I'm going to switch to budget now. So the November plan eliminated 190 uniformed positions, and with the savings incurred after this reduction, it would be approximately $14.3 million in 2024, increasing to $30.8 million, but then that was reversed. So can you provide a description of how this reversal of the pegs that you were going to have to kind of work around, how they have increased your budget, and what services will remain in place and others that may not?
Absolutely. I mean, as you can imagine, we are very appreciative of the mayor with his commitment to public safety, reversing those cuts for us. Those cuts were two things: the 5th firefighter, as was mentioned, and that's especially important given the environment that we're in right now that we were just talking about. With the lithium-ion battery crisis, really presenting more dangerous fires than ever. We were very grateful to have that additional staffing back. And the other additional positions were not frontline positions, but they were long-term light-duty members who we are able to make sure that they are not separated from service. So we are very grateful that both of those cuts were restored.
We were able to replace the 20 engine companies that had the fifth firefighter.
Yes.
So that was wonderful. So has the demand for the fifth firefighter gone down or gone up since the lithium-ion batteries have caused so many additional fires in our city?
Good morning, Chair Ariola and all council members. Well, you know, we respond to fires. When we get the 911 call, we respond the same for every type of fire. We don't necessarily know it's a lithium-ion battery fire. The demand for the fifth firefighter has not increased due to these fires. Certain situations trigger us putting the fifth firefighter on the apparatus, and mainly weather-related events. A large amount of snow could trigger us to use the fifth firefighter, and that's for practical reasons where stretching a hose line becomes more difficult because of the snow, and it's more taxing, and we need more, and it's also probably a delay in other units getting on the scene. So we need the extra hands. But under normal conditions, we have been operating. When this happened in 1990, through collective bargaining, where they lost the fifth firefighter, we have changed our operating procedures way back then. We continue to operate under those same procedures, and it's been effective.
Thank you so much, Chief Hodgins. I would like now to turn to our committee members. Councilmember Schulman.
Thank you, Chair, and thank you, Commissioner, and the Fire Department for all the wonderful work that you do. There was an e-bike shop in my district, a few blocks actually from where I live, that you closed down because they were selling illegal batteries and everything else, and there were other issues there, so much appreciated. So my question is, the department has uniformed personnel complete risk-based and mandatory inspections based on fire code and fire operation requirements. The number of risk-based inspections by uniformed personnel has decreased in the first 4 months of fiscal 2024. What do you attribute this decline to?
There's been many different things going on in the city that could potentially contribute to that. Typically, that number will fluctuate throughout the year, but there's been, typically in, say, the borough of Manhattan, each engine company is responding to between 5,000 and 7,000 responses a year. With that workload, there's not a lot of time in between to do inspections, because we do it on duty. So I think that has contributed somewhat to, the small decrease. But whenever we have the opportunity, we're out there, we're doing the inspections. There really has been no policy or anything that would create the deficit, but we're always monitoring and making sure that, we're keeping track of everything closely.
Do you need more inspectors?
In this case, it's the fire companies that do these inspections.
Okay.
So that really wouldn't apply.
What is the average length of time between the request for an inspection and when the business owner receives the certificate of occupancy?
So that refers to a fire prevention issue, meaning a business wants to open up. They submit plans to fire prevention, and plan reviewers examine, and if they pass, the ultimate result is they get an inspection. In 2022, the wait time was between 13 and 16 weeks. But we've made some great efficiency improvements, and at this time, the wait time is 3 to 4 weeks.
Okay, and let's see. This is just a general question. Can artificial intelligence help with any of the operations around the fire department? Because obviously it's a new arena, and there's a lot of talk about it.
Yeah, absolutely. You might see recently some articles about project we have with NYU that's based on artificial intelligence, where we're going to be using what they call a digital twin that we make along with NYU to study the impacts of traffic, which we already know is having a huge impact on our response times. And so to understand what sorts of changes we can make that would help decrease that, and even just understand better what is actually happening with traffic and how we can think outside of the box in order to deal with that increase in traffic, so that the issue isn't, how to get from where we are to where the patient is with too many cars in between for us to go even with lights and sirens. We're also looking at a number of other areas where it could be helpful. So talking to DHS, talking to the lab here that DHS has about the different uses of AI, especially when it comes to ensuring, greater situational awareness, which is really always what we're trying to give our members of fire and EMS when they're going into a situation in the middle of the night with mere minutes or seconds to respond, trying to understand how AI can give them more information about what they're responding to. So we think it's an exciting new space, potentially will save lives, and we're going to keep looking at it.
I would love to hear the progress of that. So 2 things I want to mention. One is, if there's anything that you think the council can do, especially, so I sit on the Zoning and Franchise Committee, where when we have new developments, if we need to ask them to put a separate place for e-bike storage or anything like that, we should talk about that and see what we can do, especially now with the City of Yes. Have you been in conversations around that to add this to that equation?
Yeah, we've been asked, and it's really been granted to be included in those conversations earlier for 2 reasons. One, and Hudson Yards is a good example, is understanding what growth is going to occur in that area may precipitate the inclusion of an EMS station or a firehouse in that new neighborhood, as well as making sure that the infrastructure that we're talking about with e-bikes, especially the outdoor charging stations, can be part of the plan. So we've been included in those decisions, in those conversations earlier, and we're hoping that makes a difference, as you're saying, to the city of the future.
Okay, great. And so as chair of the health committee, so 2 things. One is, as you know, the mayor launched Healthy NYC. The council codified it through legislation that I introduced. We're going to be talking to stakeholders, the commissioner and I, so we want to make sure that EMS is part of that equation, the fire department is part of that equation. That's one. The second is that the Office of OCME comes under me, so if there's anything in terms of even legislation or any kind of resources that you need around that in terms of the contaminants that you're looking at, in terms of the victims, please let us know.
We appreciate that very much. We'll send you a briefing on what we're doing with OCME and the contaminants so you can understand how they're being helpful. And then, of course, I've also spoken to Commissioner Vassan, and I know you know this, but it's worth emphasizing that, for so many New Yorkers, if they do not have access to primary health care, EMS becomes their primary care. And while we are always happy to respond, that's usually not the best care, but also it explains the increasing response times for EMS because call volume is really skyrocketing, especially with those non-urgent calls for people who need care and don't have any other place to get it. And so we would love to work with you on how to make sure those New Yorkers have better access to better, more appropriate care.
Absolutely, much appreciated. Thank you. Thank you, Chair.
Thank you, Councilmember Schulman. You made mention of the fire prevention inspectors. When was the last time there was a fire prevention inspector class? So where there were hires?
Yeah, I actually don't have the specific month of the last fire protection inspector class, but I will say that we have been hiring up in that title, so we're currently at budgeted headcount. It is one of the titles that has been exempt from the hiring freeze restrictions.
Great, and what is the budgeted headcount?
For fire protection inspector and other positions in that title series, the budgeted headcount is 377.
Great, thank you. Councilmember De La Rosa.
Thank you, Chair, and welcome. Thank you for being here today. I have a question. So I chair the Civil Service and Labor Committee, and one of the issues that continues to come up in those conversations is around the EMS and the paramedics, and obviously dissatisfaction with the raises that have been negotiated. Our concern is really retention of this critical service and then response time impacts if we're not able to retain. And so I wanted to ask around what are the plans around those contentious discussions at the moment, and what can we do to help in that conversation?
Yeah, I mean, I appreciate your advocacy always. I think you and me and the mayor all agree that EMS should be paid more. I think that's been a pretty consistent message of mine, and I've fought for that in all of our past contract negotiations, but we continue to see them being paid less than any of us would want to see. So, I know the mayor mentioned this week his commitment to that issue. We remain committed to it. We are hoping we can look at what's happening with collective bargaining and figure out what the next steps are. Certainly, retention concerns us as well. I will just say one thing, on behalf of our members, the increase in response time is really related to external factors that are not controlled by EMS. Our members are responding with the same dedication and swiftness they always have, but between traffic and the increased call volume to 911 and the closure of hospitals, that is really what's impacting EMS response time, and those things are outside of our control. So certainly just want to mention that on behalf of our members who, are graciously dealing with all of that and continuing to do even more work, which is really exhausting, but definitely agree that we want to see them paid more in the future.
Before we go on, I would like to just welcome students from 721M, which is in Councilmember Botcher's council district. So in case you didn't know, you're at the Fire and Emergency Management budget hearing, and this is where we talk about how much the agencies of the fire department and NYSEM, New York City Emergency Management, how much money they need to keep going and the programs that they have and what programs are working and what programs aren't and where we can change it and where we as council members and members of the city government get together to have good, honest conversation about it, and then after it's over, we get to work on seeing how we can make it happen. So thank you for having an interest. This is Civics Week in school, so just thank you for being here, and if you have a question, you can just let Nasli know and she can run it down to us. Thank you. Okay. I'd like to just continue in the vein of EMS. So according to data provided by the FDNY to Council in December of 2023, 40% of the city's ambulances were out of service, meaning that nearly 300 ambulances were not available to provide New Yorkers with vital emergency care. This is particularly notable as emergency response times for the department continue to increase. For what reason would an ambulance be out of service? In terms of out of service ambulances, what is the breakdown of those units, and in terms of basic life support versus advanced life support, ALS?
So in respects to ambulances being out of service, there could be numerous reasons. Most of them are mechanical. When you have a vehicle that runs for a 24-hour period, 365 days a year, you can definitely imagine that there will be wear and tear. We do have a spare fleet in which we inhabit. During and after COVID, the amount of parts that you can receive in respects to the mechanics, spare parts that they would need to fix those vehicles, there were numerous delays in respects to that. So that would account for some of the units being off service. As far as 40%, I'm not quite sure that we were at 40% off service rate at any given time. We ran our tour counts for the most part. Anytime that we didn't, it was not because of vehicles being off service. It may be more of personnel sick leave.
When they're out of service, was it ever because it was due to the department's inability to meet the established staffing levels at any given point for paramedics and EMTs?
In respects to paramedics and EMT headcounts, we are above. We're above headcounts with paramedics and EMTs. So that was not the issue.
Mm-hmm. That includes with sick leave, right?
Give me the whole question.
What is the sick leave rate? And we know that you're above in head count, but is there a sick leave rate that would significantly reduce that head count and put you in a position to not be able to run your ambulances?
We check sick leave or medical leave rate weekly. Dr. Bazan provides those numbers. Last rate that we checked, we were at 10% in respects to sick leave. And please, everyone understand that these are paramedics and EMTs that are dealing with sick patients, sick residents, so therefore they are coming in contact with communicable diseases, so therefore they, on occasion, are sick.
100% understandable, and I'm surprised that it's at 10%, considering what they do and see and who they take care of on a daily basis. So in what title roles is there the greatest need for increased headcount to ensure more ambulances are operational?
Officers, our frontline officers, which is the lieutenants.
How does the FDMY account for difficulties in maintaining adequate EMS headcount?
Right now, our headcount is adequate.
Right.
We are in preparation for future promotional examinations within the fire department. We have an increase in the EMT headcount right now. We also have an increase in the paramedic headcount because we haven't been able to promote lieutenants due to we don't have a DCAS examination right now. So in respects to headcounts for the frontline officers, other than lieutenants, we're good, we're sustaining.
All right, good. And the mayor's announcement for pay parity, a possibility of it, couldn't hurt either, right?
It shall not hurt, no.
It won't hurt for when the next test is given. So let's put that out into the universe for reality. I want to talk about mental health. Oh, did you have a question? I'm sorry. Oh, you want to go on a list to ask a question? Go right ahead. Go right ahead.
I'm sorry, thank you. I wasn't trying to interrupt, but thank you so much, Madam Chair.
Casa su casa.
Just really quick, I want to make clear, because I know Andrew Adamsborough for the Uniform Fire Association mentioned the 5th firefighter need. So are we saying that we don't need additional engines to have firefighters that don't have it now, the 5th firefighter? I just want to be clear about that.
I think we're saying we're very grateful to have it on the 20. That is part of collective bargaining, but the mayor generously gave that back to us in the PEG. And we also do apply the 5th firefighter to all engines in a number of cases. So we are able at this point to use it when we need it most under the mayor's guidance. Because it's a collective bargaining issue, we will be bringing it up in collective bargaining to see if there's additional flexibility that could be given to the department in the future that doesn't limit it just to those 20 or to certain emergency situations.
Okay. So if I can use my words, not yours, the 5th firefighter would absolutely be helpful if it can be done. Is that a good synopsis in my words?
Yes, absolutely.
Okay.
More hands is always better. You know, but as the commissioner mentioned, it's not up to the fire department. It's a collective bargaining issue.
I'm 1,000% understanding what's happening.
Yeah.
Now, with the lithium, I appreciate the responses. So I just wanted to be clear. Are we saying that we haven't found the right bag yet, or are we just now starting to test to find the right bag? I just want to see where we...
No, right now there's not a product on the market that has withstood our testing.
Okay.
We don't think that means there isn't. We're continuing to test them. Sometimes it's, some work better than others, and so with the ones that work better, we're trying to figure out how they can get to that final point where we could really sort of guarantee that they can make a difference. But like I said, I think for us, we're going to continue to do that. I do think it's essential, and we can include you in those demonstrations that the vendors give to us, but also getting them outside also will do something similar, right? If we can get these outside outdoor charging stations and the exchange sort of programs that you mentioned.
No, 100%.
Yeah.
The infrastructure, I know that may take a little longer, and we've been facing some NIMBYism in trying to get some of those charging stations out there, so I know there's it's gonna be a little push. So I'm trying to find something that can be done immediately. But if we can find a product that works between you and DCWP, could we be able to get it out the way we do with the smoke detectors and
Yeah, I mean, as soon as we found a product that worked, we would let you know, and we'd go to every avenue possible, whether it's requiring the delivery companies to fund them as they do now with some of the equipment, or a public-private partnership. But I agree, if we found something that we knew would work, we would really urge people to get it out there publicly. And I'd also say, if you're facing any resistance to these charging stations, please let us know. I can't emphasize enough how important they are in saving lives. So if we can help, ring that alarm that getting these outside and having these charging stations is essential, we'd be happy to do that.
Thank you. And just lifting two things up, don't have to have a response. I just want to make sure I name it. One, I want to just associate myself with the council member that left with the pay parity with the EMTs. And also, I know the Vulcan Society has had some issues brought up, particularly with black firefighters and issues that they're facing and a whole range of things. I just want to make sure I name that here, and hopefully we can follow up to figure out how to address those concerns.
Yeah, both of those issues are incredibly important. We'd be happy to follow up with you.
Thank you.
Okay, I'd like to address mental health services. So how much funding does the FDNY's Counseling Service Unit receive from the department? And are there other sources of funding for CSU? And has CSU funding increased in the past years?
I don't know if Lizette has exact figures. If not, we can get them to you. We have seen some increases, but I would say it's important to note that CSU is largely funded with grant funds, ranging from the World Trade Center to the IAFF to other forms of national firefighting organizations and a lot of private donations. So we certainly have seen not only an increase in funding, but we've actually deployed some of our active duty uniform members, including training a lot more members of EMS to be peer counselors over the last few years. That was especially important coming out of COVID and what they faced coming out of COVID. Do we have exact numbers? If not, we can circle back.
We don't have exact numbers, but we can follow up. You're right, though, that it is supported by not only city funds, but significant grant resources as well.
I think it's particularly important because we have had cuts to the Be Heard program, and we know what mental health services is vital to our first responders and making sure that they get that. Do you know what the current budget is for Be Heard?
The current budget associated with Be Heard is $24.9 million.
And do you think that is sufficient funding for this program?
That funding supports not only the dedicated units that exist right now, but also supports a differential for the entire EMS workforce that was tied to mental health training that was rolled out to everyone.
Okay, and how efficient is the Be Heard services?
Be Heard services are extremely efficient. I believe we had a total of 5,000 calls for the first half, January 1st, 2023 to June 30, 2023. We responded to 5,000 calls. The very important part of that is that 42% of those patients received additional services. And what that means for me, especially, is that they're not calling 911 again. They're able to get directly in connection with the mental health services that they need. So Be Heard is definitely a high-performing part of the EMS services. It takes care of the mental health emergencies of New Yorkers, and it's definitely essential.
Thank you very much. I'm going to switch now to our legislation that I was proud to sponsor about putting facilities for female firefighters in houses that were able to accommodate it. So now that the survey is completed, what are our next steps?
So the next steps are internal briefing. So I'm actually being briefed Monday. I will let you know how that goes. But also to brief the United Women Firefighters, who represent our female firefighters, and a number of our other stakeholders, including the Vulcan Society, who represents a number of the female firefighters as well. And after we do that internally, we will circle back to the council and can let you know where we're at. And then I believe that the law requires us to share that by June. So all of those meetings will happen between now and June.
And those meetings that you had with the surveying, that was inclusive of women who were firefighters and inclusive of their input, yes?
It is, but one of the reasons we want to meet with the UWF and the other fraternal organizations afterwards who represent the women is they may represent women who either were on medical leave or otherwise not assigned to their firehouse at the time that this was done, or frankly the perspective, they've all been female firefighters in our department for many decades, most of them, so they may have some perspective that wasn't maybe available to the individual firehouse, but to the larger plan for the department, especially in terms of, as you know, overhauling a fire department facility is quite difficult given how old most of them are. So some perspective also of how we can prioritize some of the most acute needs of the women.
Right.
So we do believe their input will, although it has already been included, the individual members in the houses, that the input of the fraternal organization may add something else to this report.
And during the last few probationary firefighter classes, has the chief officer inspected the women's bathrooms before the woman was assigned to a house?
Yeah, so for every graduating class, once we know where the female firefighters are assigned, we do a number of checks between fire operations, the academy, my office, facilities, and the UWF to make sure that that firehouse in particular is ready and that the facilities are up to date and ready for the woman to arrive.
And during the surveys, you had to come across bathrooms that were already there in some firehouses. Have funds been allotted to repair those bathrooms for the female firefighters and locker rooms?
I don't know that we fund that specifically. Certainly they do get, some of them that are out of service and have a woman assigned do get repaired. I don't know if there's a separate budget line for that.
There isn't a separate budget line tied specifically to female firefighter bathrooms. All of our facilities should have a female firefighter bathroom already. To the extent that there are repairs necessary, we do have lump sum funding for facilities improvements. So over our 10-year plan, our facilities improvements are actually close to half of our budget.
Right, because there are some firehouses that have even 3 or more women in it, so we would need some type of renovation to make the accommodations larger. Let's see. Okay. Prior to the survey being completed, and now that it is, and prior to us being able to implement what we have found, have there been any short-term solutions to assisting females who are firefighters who work in a house that may not have a female facilities for locker room and bathroom?
Yeah, a number of them are. So the fact we do have a female facility in every firehouse, that was a short-term solution put in over the last few years to make sure that there was at least that minimum standard in any firehouse. Again, as you know, because they're so old and there's so much time and money that required to overhaul them, often we've had to make do with what was there, right? So we converted an existing space into a bathroom and locker room for the women. We've also put into our specifications for all future facilities a full female bathroom and female locker room to accommodate what we hope is a growing number of women in the department. So you will see any new renovation reflecting that, but certainly in every firehouse we've made sure that there's a facility. We've also put in pods for female firefighters who have recently given birth and are breastfeeding. So there's a number of accommodations we make, but I will say we always, as you just mentioned, need to keep making adjustments. It's great that there'd be 3 women in a house, but that is something that when we actually assign that 3rd woman, we have to make sure is what we did on a short-term basis actually enough to accommodate 3 women. So we always are making adjustments as we put out new classes.
That is very good to hear, Commissioner. We want to talk about okay, it's just us. So FDNY Foundation, what are the sources of funding received by the FDNY Foundation?
Do you mean what do they pay for in the department?
No, what are the sources of funding that they receive? I know we fund them, right?
So you'd actually have to ask them. We are not privy to who donates to them. I will say you are one of the council and the mayor's office have long been 2 of the biggest donors to the FDNY Foundation. Also, our partners in public safety are often donors. So smoke alarm companies like Kidda have long donated a large portion of their products in kind to us to make sure we can get them out there. But we can ask the foundation. I believe they may have some sort of public filing that's required.
That's fine.
We can ask them and give you a list.
That's fine. I know recently we met regarding the Davidson Law. We had a meeting, and I think it was very productive. And I'm not sure if you came prepared for questions on the Davidson Law today, but if not, I would like to, after the meeting, just give you the questions that we have
Yeah,
If you
I can
are,
answer
we
it
would love
broadly.
any updates.
I can answer it broadly. Fire operations is compiling the data you asked for in the letter, and we'll get that back to you fairly soon. But I'd say two things, and I know you share this. The Davidson anniversary is coming up in just a few days, and I just want to emphasize that, like, even to this day, how present his loss is for all of us. I was there at the hospital, and everybody on this sitting up here was in the department at the time, and it was just absolutely heartbreaking. And we continue to want to make sure that this law is implemented in his memory. And as Eileen Davidson has continually pushed for this, we're so happy to be working with her. So on the two parts of the law, there are two parts, as you know. The first one has been implemented for a while, and that's the sharing of the movie production locations with the local firehouse. That has been going successfully for the indoor alterations, which is where the real concern is. That is what happened in the Davidson fire. But we actually learned through your meeting last week that the fire companies wanted more information on the outdoor locations, and so operations is working to make sure that they're getting that data, and that we'll have an implementation date by the time we write back to you with the letter. On the other piece of the law, which is the rulemaking process around the fire safety directors and other pieces of that law, we are planning, I believe, to meet with you again to come back together and discuss how we want to move forward with that, balancing our safety concerns with the concerns of yourselves and the industry.
Thank you. I very much appreciate that. Just give me a moment. Okay, I have checked with everyone. You have been terrific. Thank you so much, Chief Hodgins, Commissioner Kavanaugh, and everyone on this panel for having answers to our questions. And if any other questions arise, after you leave, then we will be happy to send them to you. And I look forward to the good work that we're going to do together in the future.
Yeah,
Keep
thank
this
you for
city
your
safe.
continued support of our agency. You've always been
Always.
consistent, and we appreciate it.
Always. Thank you.
Thank you. Thank you.
We're going to take a short break until NISM comes. Thank you.
You could say,
We're going to start with while we're waiting for NISM, we're going to start with the public portion of the testimony regarding the fire department. So I'm going to now ask our counsel, Josh Kingsley, to call up the first person for public testimony.
Thank you so much, Chair. We're going to do some folks here now, and then after NISM goes, anyone who hasn't had a chance to speak will also be called then. So first we'll hear from Michael Reardon, followed by Michael Tracy, followed by Helen Northmore. So you could come up one at a time or two at a time, however you choose, and then we will go from there. Thank you. You all may begin. Michael Reardon, you may go ahead first. Thank you.
I'd like to thank City Council Chair Joanne Ariola and all City Council members for allowing me to speak today on behalf of the fire protection inspectors. With the help of the City Council, we had 2 separate classes of new FPIs during the month of April 2023, and we had another class, a class of 45. In October, we had a class of 50 FPIs, so I thank you for your help on that, pushing that through. The FDNY budget canceled our April 2024 class. We need 2 classes, one this year at least, and one next year. The department doesn't look at the Fire Code Chapter 4 for the need of hiring more fire inspectors. We are now operating, I believe they said 377 inspectors to date in 2023. We have lost some FPIs to other agencies and some moving out of the city. We are seeing few retirements in 2023 and additional senior inspectors start in 2024. All the construction going on with the new buildings up in the 5 boroughs, this will require a need for more inspectors so we can keep up on our daily inspections as well as testing and all types of fire suppressant systems in all types of buildings, restaurants, commercial facilities, power plants that we are testing at. Our CDA unit, which is our construction unit, are inspecting construction sites every day to ensure compliance to safety measures, issuing permits, checking fire protection systems required at all construction sites. Fire prevention is in desperate need of new equipment to do our jobs better and safer in the 5 boroughs. In 2023, fire prevention brought in, I believe, around $61.9 million to the city. If we were given just 1% out of this, we would be able to provide CO meters, gas meters, safety harnesses for climbing up on the water tower tanks on buildings, climbing up on the into dikes surrounding bulk fuel facilities where there's million-gallon tanks. Bulletproof vests for our public assembly unit performing nighttime inspections at places of public assembly, nightclubs, etc. And our special inspection unit dealing with salvage yards, metal scrap yards, junk yards, illegal storage of propane, compressed gases, cylinders, gasoline, and many other hazardous materials. Enforcing new legislation regarding lithium-ion batteries used for personal mobility devices, ensuring safe charging and storage requirements are met, ensuring proper handle and removal of compromised batteries. I gave you a copy of what this unit does. There's many things on there, and I wish the council would review that and see all the work that this one unit is doing on their own. Department vehicles are required for working in the 5 boroughs. Working night and details, you know, having high mileage, been in accidents, these vehicles are never replaced. We're constantly having to take public transportation or inspectors are using their own vehicles, which is unfair. There are additional equipment required, too much to list here. I want to be clear, not all our units are the same, need the same equipment. We all perform different inspections throughout the city. We need a separate budget for all types of safety equipment. Our overtime cap, FBIs do not have a cap for overtime. Our level 2s and 3s inspectors were capped in starting January 1st, 2024, and we're still capped today. We're not getting any reason, why. After filing a grievance last year, our caps were raised in December 2023. To put in, many of us are still capped, and OMB is holding off on approving our caps. Our union lawyer has been working with the department on raising our caps. Many inspectors are still putting in for overtime on paper so that they can submit their overtime in and when overtime is approved, if ever approved. We can't get everyone on board to stop working overtime, which many companies, contractors, fireworks companies would suffer, and most of all, many people would be unsafe in the city. Fire protection inspectors' main goals are, and has always been, to keep firefighters, all the people living in the 5 boroughs, as well as visitors, people on vacation, doing their safety inspections to keep firefighters and everyone else safe in the city, and testing all the fire protection systems. I thank you for your time.
Thank you so much, and thank you so much for all that you do. And I think it's important that people know that fire prevention inspectors are uniformed officers and not civilian members of the fire department. I thank you very much for that. Now we'll hear from Mike Tracy.
Good morning to the committee. Good morning, Chair Ayala. Good morning, Councilwoman Schulman, Councilwoman Brewer. Thanks for the opportunity to speak. Happy budget season. I just wanted the opportunity to affirm some of the fiscal needs of the department and how it relates to the life safety, not just for the citizens of this great city, but also for the health and safety of New York City fire officers that we represent. While we acknowledge many of the accomplishments that the Commissioner mentioned in her testimony, the UFOA believes far more can be done by identifying gaps in the budget. For starters, as the Commissioner noted in her testimony, lithium fires have wreaked havoc on this city, killing citizens and destroying property. While this issue has been given sufficient attention in the media, what has gone largely overlooked are the potential health effects these fires place on firefighters and fire officers. We employ the city budget to allocate funds towards health monitoring and early cancer screening. Additionally, we need to get these batteries off the streets and out of buildings. Battery buybacks, much like the gun buybacks that have existed for decades, is one idea that can help reduce the risk of these batteries as they age, get damaged, and pose greater fire risks. Speaking of guns, yesterday we were reminded of the dangers firearms pose in public areas. Many in the council may not be aware that there's a procedure for firefighters and fire officers to respond to active shooter events. We are now being asked to do so with only 1 day of training. I was a member of one of these units and was expected to enter active shooter warm zones with just a few hours of training. We asked the City Council to allocate additional funds to provide adequate training days. The age of some apparatus precludes companies from inspections of hydrants and buildings. We asked the budget to address the backlog in these old apparatus so companies continue to do these duties. And lastly, the New York City Fire Department has not been immune to some of the staffing issues that other agencies have faced since the recovery of the pandemic began. While the change in the city's fiscal outlook has addressed some of these budget cuts to the department, and thus the staffing issues fire officers face is not necessarily budgetary in nature, the city has created a staffing crisis by failing to properly grade, process, and eventually promulgate a list for the most recent lieutenant's test. This issue mimics fiscal cuts by pushing officer headcount to dangerously low levels, leaving the fire officers supervising firehouses in this city overworked from the increased fire duty. We'd also like to note that the 10 members of this department who have not been rehired due to the vaccine mandate. These two issues and the fiscal implications that can result can be fixed today. We implore the city to do so, in addition to assuring an adequate budget for this department to help the greatest fire officers in the world do their jobs properly. Thank you very much.
Thank you so much, Mr. Tracy, and you're right. We need our firefighters back. Thank you. Ma'am.
Chair Ariola, Member Schulman. Sorry. Chair Ariola, Member Schulman, Council Member Brewer, and all the members of this committee, De La Rosa, Feliz, Gennaro, Riley, and Yeager and Schwan. The 4,000-plus women and men of the FDNY Emergency Medical Services, the EMS, who are New York's best, deserve equity in pay and benefits with New York's bravest, New York's finest, New York's boldest, and New York's strongest. On page 9 of today's report on the fiscal 2025 preliminary plan for the fire department, we can once again read, quote, "The EMS are consistently the lowest paid first responders in New York City. The council has long advocated wage equity for the EMS, making their salaries competitive with other first responders," unquote. Unfortunately, this is nothing more than a rehash of a recurring theme in such council reports. 3 years ago, when the same members of this committee were not on this committee, in March 19, 2021 report, one can read, quote, "As the lowest paid first responders in New York City, the council has continually called for an increase in the salaries of EMS members," unquote. Well, as we all know, wage and benefits parity didn't happen when the city negotiated the EMS labor contract that year. Over the years, members of this council, including the chair, have spoken many kind words in support of the FDNY EMS. The sad fact is that no council report, no mayoral candidate's promise, no council member's speech, no council law, and no council resolution has ever brought pay parity to the FDNY EMS. We can all ask ourselves, how is that? In this year's report on the fiscal 2025 preliminary plan for the fire department, emergency medical personnel are still referred to as civilians instead of the uniformed first responders that they are. FDNY EMS members are still paid not thousands of dollars less, but tens of thousands of dollars less a year than the other uniformed services: sanitation, corrections, police, and fire. The pay gap between EMS and the other uniformed services keeps getting wider. For example, under their new contract, sanitation workers will make 40% more than emergency medical technicians. Pay parity has been achieved in this year with other city workers. The 8,000 nurses of the city's Health and Hospitals Corporation have gotten pay parity in their contract. In the first year of their contract, nurses' salaries will jump $16,006, and then jump another $5,551 in the second year, a jump of over $21,000 in 2 years. I asked this city council to adhere to the words of Council Speaker Adams. On Wednesday, she stated that the council is a co-equal branch of city government with the duty to turn ideas into effective laws and to conduct oversight. Take action and conduct rigorous oversight in this budget process to guarantee that the city treats the FDNY EMS as the uniform first responder that it is, and that pay parity happens in the upcoming EMS contract. I'd like to share with you the headlines in today's Chief. FDNY EMS suit moves forward after judge rejects the city's arguments. Why do they have to go to court? Why do we have to spend money reimbursing the plaintiff's legal fees, over $600,000 for one case alone? And this is about the fourth case. Thank you very much for letting me share my views.
Thank you for your testimony. Thank you so very much. I appreciate you coming in. Thank you.
Thank you so much.
I would like to invite Nysum up to the table. Hi, how's everybody? Hi.
So you could read your opening for NISA, pass it to me. Do you have a separate?
I don't think I have a separate one.
Tammy, is there a separate opening for NISA? No. Okay. So just welcome them and
I
I'll
will.
swear them in.
You got it. For the record, I'd just like to note that we were joined by Councilmember Gail Brewer as well as Minority Leader Joe Borelli. So I want to welcome Commissioner Isco. I'd like to welcome Commissioner Isco, Deputy Commissioner Christina Farrell, and your name, sir?
Christopher Blanco, Chief Financial Officer.
I welcome you as well, and we look forward to your testimony today. I'm going to now turn to Council Josh Kingsley for you to be sworn in.
Sure. Thank you so much, Chair. So for New York City Emergency Management, we'll hear from Commissioners Zach Iscol, Christina Farrell, and Christopher Blanco. Can you please repeat the following? You affirm to tell the truth, the whole truth, and nothing but the truth in your testimony today, and to answer honestly to council member questions. Just affirm that you will indeed. Okay. Thank you so much. You may go ahead.
Great. Good morning, Chair Ariola, Councilmember Schulman, Councilmember Brewer, and members of the Committee on Fire and Emergency Management. I am Zach Iscol, Commissioner of New York City Emergency Management. I am joined today by our remarkable First Deputy Commissioner, Christina Farrell, and our wonderful Chief Financial Officer, Chris Blanco. As the agency serving New Yorkers before, during, and after emergencies, the emergency management coordinates the city's preparedness, response, recovery, and mitigation efforts in an ever-evolving threat landscape. We are thankful for our government, nonprofit, private sector, elected, and community partners who help us serve New Yorkers as we build a more inclusive and resilient city. 2023 was another busy year, and the pace in 2024 has not let up. Time and again, our staff adapts plans and strategies and responds, always incorporating lessons learned from previous incidents to improve outcomes for our city and its residents. I'm incredibly proud to work with the best, brightest, and hardest working emergency management professionals in the world, and would like to highlight some key programs and data points. Emergency management continues to keep the public informed through the Mayor's Management Report, submissions, and the agency's annual report, highlighting the impressive progress the agency has made toward achieving goals outlined in our strategic plan. Notable recent accomplishments include preparing city government and external partners for disasters by holding the agency's first in-person interagency emergency operation functional exercise since 2019, which included over 100 participants from partner agencies, and we've offered over 100 instructor-led emergency management training sessions. Our most public-facing program, Notify NYC, which is available in 14 languages, including American Sign Language, issued almost 2,500 messages last year, and we are currently at over 1.22 million subscribers. The Notify NYC program continues to evolve. For example, in 2023, Notify NYC launched a notification group for residents living in basements or cellar apartments to sign up for notifications regarding life-threatening weather conditions, with over 2,500 New Yorkers currently subscribed. Additionally, Notify NYC expanded graphics for messages to increase message accessibility and clarity for all users. Emergency management also continues coordinating emergency response and recovery for disasters of all scales and types. Our Operations Bureau, which tracks incidents 24 hours a day, 7 days a week, monitored and responded to over 2,200 incidents in 2023. These included building collapses, infrastructure incidents, the asylum seeker emergency, water main breaks, incoming weather, fires, and more. Regarding activations, we continue to be activated for different phases of the city's asylum seeker operations. We also simultaneously activated over the past year for extreme weather, significant fires, building, parapet collapses, and other emergencies. In 2023, our CERT volunteers participated in a total of 203 deployments and reported 13,375 volunteer hours. The program trained and added 90 new volunteers to the program. The Strengthening Communities program added 20 new networks to its roster, expanding the program to include a total of 35 community networks across all 5 boroughs, working towards more equitable response and recovery operations in hard-to-reach communities. These partners helped us distribute over 2,450 hydro barriers and 2,900 flood alarms throughout the city, organized 18 preparedness events for National Preparedness Month, and spread the word during the September 29th flood emergency by amplifying our messaging and notifications through multiple social media posts, 49 emails, 263 text blasts, and 624 phone calls to over 44,000 community members in all boroughs. Ready New York held 330 preparedness events across the city, trained nearly 28,000 New Yorkers in emergency preparedness, and distributed over 52,000 emergency preparedness guides. In September 2023, Ready New York and CERT celebrated their 20-year anniversaries with Mayor Adams issuing a proclamation recognizing September 12th as Ready New York and CERT Day in recognition of the contributions of the program to increasing preparedness. Emergency management supported the city's response to the asylum seeker emergency by opening and operating respite sites for overnight guests. We continue to manage the wait list for all available cots, including coordinating overnight waiting areas with our partners at New York Disaster Interfaith Services and the Housing Recovery Office. Since October, we have been operating a reticketing center that has reticketed over 3,000 guests. Emergency management has also supported the expansion of humanitarian emergency response and relief centers and partners closely with the Office of Asylum Seeker Operations, the Mayor's Office of Immigrant Affairs, Health and Hospitals, Housing Preservation and Development, and other agencies to identify a long-term strategy for the influx of asylum seekers, helping support the city's transition to a sustainable operation. We continue to look ahead to find new ways to prepare the city and our residents for the next emergency. With that, let me now provide a snapshot of our budget for the next fiscal year. Our projected total fiscal year 2025 city tax levy expense budget is $170.7 million, of which $141.2 million is for the agency's asylum seeker emergency. We rely on our city tax levy expense budget to support the majority of the agency's administrative, technological, and operational costs. The projected fiscal year 2025 city tax levy personnel service budget is $9.5 million, which supports the 82 personnel lines paid directly through our city tax levy funds. This includes $1.5 million in funding for 16 staff members dedicated to working on increasing communication and services to people with disabilities, access, and functional needs. Our other staffing is supported through grant funds and personnel on assignment from multiple city agencies. Our projected fiscal year 2025 other than personnel services budget is $161.2 million, which includes $141.2 million for the agency's asylum operations. The remaining $20 million covers all agency operating and administrative costs. This budget includes a significant portion of non-discretionary funding. These funds are designed to cover our warehouse lease, utilities, and telecommunication costs, including the maintenance and operation of our emergency operations center and our backup facilities. This money also supports our fleet and all additional equipment, supplies, and material needed to run the agency. The agency receives grant funding to support many of our core programs. In the past year, we secured $33.3 million in federal funding, primarily through the Urban Area Security Initiative grant. This funding is vital to our ability to run many of our initiatives, including the Ready New York Public Education Program, Community Emergency Response Team Program, Continuity of Operations Program, Geographic Information Systems, Training and Exercises, Watch Command and Response, and Citywide Incident Management System Planning, and the Emergency Supply Stockpile. We work with City Hall, OMB, the city's congressional delegation, and our partner agencies to push for full Homeland Security funding in future years. This money supports critical operations within ours and several other agencies' budgets and is critical to the city. I would like to express my admiration for our incredibly hardworking and dedicated emergency managers who continue to work tirelessly to ensure our city meets challenges. I am honored to lead this agency and look forward to continuing our progress and growth. Thank you for the opportunity to testify today. I look forward to working with the council, and I am happy to take your questions. Thank you.
Thank you so much, Commissioner Isgall. Thank you for all that you do. I always say that I'm so proud to be the chair that oversees NISM because they are a really small agency that does a really big job, and you do it well.
Thank you.
Thank you. In November, we all got a little bit of a scare because you guys were going to realize some cuts, and then the mayor, thankfully, found that he was able to reverse some of the pegs. And we were most interested in our flood protections program. So can you provide details on the importance of the interim flood protections program in providing temporary coastal surge flood risk reduction for critical New York City facilities and low-lying neighborhoods like are in my district?
Yep, and we spend a lot of time in your district.
Yes, you do.
You are out there with us during every weather event, in your boots, knocking on doors, making sure even beforehand that we're communicating to your residents and your constituents. And we really appreciate the partnership with you and your office. I think the key part of the Interim Flood Protection Measures Program is the I. It's an interim program. It was established in 2016, initially with 57 locations. Of which approximately, I think it's 32 are for DEP sites. We managed the other 25. And the idea basically is these are interim flood protection measures. They are temporary while we build other capacity to protect both neighborhoods and city infrastructure. We have now transitioned 8 of those 25 that we were responsible for. Some of them have been transitioned to permanent measures. That's Metropolitan Hospital. A number of NYCHA facilities have permanent mitigation measures now, like Reese houses, Haber houses, East River houses, Astoria houses. Others were in the process of transitioning to other agencies for them to manage. So it's an incredibly important program. It's also one that's temporary. In terms of the cuts that were proposed in November, most of the funding is spent between July and October during hurricane season. So those were funds for fiscal year 2024 that largely we knew we may not, likely didn't have to spend. The concern was for the out years. And again, as we start to offload some of those to other agencies, as we reduce the number of interim sites that we need to measure, there's less need for that funding, although we do appreciate having it.
Can you elaborate on the potential consequences or risks of the cuts to the program that could have been posed to our safety and well-being of residents, businesses, infrastructure, and affected areas?
Yeah. So I think it was, look, this was something that the idea was not, we have tons of discretionary funding at our agency and this is where we're going to find savings. This is a program that, well, first off, at our agency, we have very little discretionary funding. And so when we are looking for places that we can find savings, it was really one of the only places that we could look at. The other part of this, though, was that because we had reduced the number of sites already, because we had been through hurricane season, there was less of a concern in terms of those savings for that period of time. In fact, and Chris, you can speak a little bit more about that in terms of the actual numbers, in terms of what we had spent and what we were forecasted to spend for the remainder of the year, the out years.
Yeah, sure. I think when we're looking at the overall portfolio of projects, again, as the commissioner had mentioned, as the number of sites has gone down, our budget has largely remained flat. So as a result of that, there's about $200,000 of unspent funds at the end of the fiscal year, which we can use to reallocate towards other planning and training exercises for the program, or to support other needs across our agency's portfolio. But largely, this was a no-impact excess funds as a result of just good management and part of the plan to transition the interim protections to permanent solutions.
And moving forward, are there any measures in place that would likely ensure the sustained support and funding for this interim flood protection program?
So I think part of the hope is to continue to offload these to the agencies that it is protecting their facilities. There are some projects in the work for some of the neighborhoods that are protected with these interim flood protection measures. And then finally, there's also, and then a lot of them now have permanent measures that no longer necessitate an interim flood protection measure because they have completed those construction projects.
Okay, I just want to talk about some staffing.
Yep.
So NYSEM, as I said before, is a relatively small city agency, and the staff are highly specialized. And it's difficult a task to coordinate emergency responses, work long hours, to deal with life, property, well-being, and the additional responsibilities that you have been experiencing over the last 2 years. In order to operate at a high level, we must retain valuable employees. What is the agency's annual attrition rate?
Yeah, so our annual attrition rate right now, let me pull this up. I believe it's right here. It's, thanks, it's 13.1%, which is down from 21% in fiscal year 2022.
Nice, great.
I'd also add, if I could, one of the things, when I came in as the commissioner, I was the fourth or fifth commissioner in a year. The agency had just been through COVID. And Christina Farrell, who is really an incredible unsung hero in this city, she and our chief of staff,
You know it.
she and our chief of staff, Joe Carina Duarte, led an effort to improve some of the things we were doing around retention. Because of their efforts, we now have 100% of our senior executive staff positions are filled. In December, for the first time, we were a majority minority agency. And on top of that, you can see the reduction in the attrition rate. I think one of the other things that they did is they really focused on developing career pathways for folks. And so when you look at our vacancies, one of the things it doesn't account for is the number of internal promotions. So when we promote somebody as opposed to hiring an outsider, it creates a vacancy. And so sometimes you then have twice the period of time where you have a vacancy because you have promoted somebody. But in terms of retention, in terms of succession planning, the work that Christina and Joka led was really critical to that success. And I think for a smaller agency where we do have specialized folks, this is going to continue to pay huge dividends for the future of our agency.
And are you going to request positions to be filled this year for those vacancies?
We're always looking to. I think the other thing I would add is we're fortunate in that two-thirds, is that correct? Two-thirds of our funding is, for personnel lines, is grant funded. So it is not impacted by reductions to city tax dollars or city tax funded lines.
Thank you. I will yield now to Council Member. Yes.
Sorry, can I just add, first of all,
Sure.
thank you. Second of all, I just wanted to say, and we were talking about this a little while ago, a lot of our staff, like you said, thank you, our staff are hardworking, they're very skilled, they're very dedicated, and that doesn't go unnoticed by other city agencies, even the state, FEMA. And so a lot of this turnover is our staff being recruited by the health department, by the medical examiner, other agencies. And while we'd like people to stay at emergency management, it is very helpful for the city, certainly, and for emergency management as well, to have our alumni in these agencies. We just ran a all-day exercise with City Hall and a lot of the operational agencies on Tuesday. And so many of the people that were participating, along with their leadership, were our former staff members, DEP, transportation. And so while we don't want people to leave, it is understandable, and it's great to have those people in other agencies. So sometimes it's a win-win, just a little.
Right.
It looks a little different.
I get it. I get it. I yield now to Council Member Gail Brewer.
Thank you, and I want to thank you because you've done a lot of outreach to elected officials, tours, and keeping us up to date. So I appreciate that. Not every agency does that. In the reticketing, according to the city record, I could be wrong, but I think there's a new for-profit that is in charge of it. Can you just talk to us about what's the RFP, who's doing the reticketing, et cetera? What's going on there?
Yeah. So where to start? This is a pretty significant operation.
And the cost of all this, too. Go ahead, I'm sorry.
Sorry, yeah, I'll turn it over to Chris to talk a little bit more about the procurements and some of the actual work that's done. But, you know, we set up reticketing operations, and this exists not just at the reticketing center at St. Bridget, but at all sites. Almost all sites have the ability for folks to get reticketed.
So all of your sites, you mean?
All sites across the city. Reticketing, almost all sites. I don't want to say 100% of them, but the vast majority of sites offer reticketing. What we did set up at St. Bridget, which is our site in the East Village, is that is both a place where folks come after they have been discharged for the system to get reticketed to other places. It's also a place where folks can go to get back on the wait list, and we manage the wait list for people to get reassigned a cot. And this is only for adults. There very rarely do you have families with children go to that site. It's only in cases where DSS has a family that needs to get reticketed and they need to get reticketed immediately, but there's no wait list work that's occurring with families with children. So it's all adult families there. Chris, do you want to talk a little bit about the contractors and the work that's done there by MedRite and others?
Sure. So for the reticketing center at St. Bridget, NYSEM holds the contract for the translation service, in-person translation, fire guards, as well as site management. The actual reticketing costs, as well as the, staff that primarily does the reticketing, is through MedRite, which is an H&H contract.
So MedRite has been there for a while. It's not, because somebody said Cherokee got a contract there.
I believe that's a new contract that's in place for
It
case
is, so
management.
I want to understand what it is doing.
So that's a brand new contract. I don't think it's been rolled out as far as actually putting folks on the ground to provide services. But my understanding is that is tied to a specific RFP for case management through H&H.
Yeah, it's a health and hospitals, and we'd have to defer you to them for more information on this, but that is a contract that they're specifically using for more intense case management. They were specifically looking for organizations that have that have more experience with resettlement operations, and also with sort of helping migrant populations. And so
they'll also be located at St. Bridget's, as far as you know?
They are, to my knowledge, they will not be located at St. Bridget's. They could be. But right now, I think they're primarily going to be at the Arrival Center or the Roosevelt Hotel, working with migrant families.
Okay. And then, so how long is MedRite's contract for? And how much is it for?
We'd have to defer to H&H on that. I don't have the specifics on that.
Okay, so you have just the translation and the fire guards.
Translation, fire guards, and as well as a handful of folks that we have through our staffing contract with Haggerty Consulting, which provides mainly sort of in-house support to us on our operations, but also does a small bit of site management at a number of our sites.
Okay, so, and who pays, which agency oversees, you get a ticket to go to Idaho? Who pay, nobody's, it's sort of like a not understood. Who's paying for that? Is that your agency? Is that H&H?
So the actual funding goes through H&H through the contract to MedRite.
Okay, so in other words, they'll know how many people are going to Idaho or Oregon or whatever.
That's right.
Okay. The other question I have is, when you mentioned the federal funding, which thank goodness, I used to write the federal grants for Dinkins, and I never think that we're doing enough. So congratulations on getting the federal grant from the Urban Area Security. How long does that last, that grant?
So I can speak to that a little bit. So the Urban Area Security Initiative is part of a larger suite of grants from FEMA, which are just known as the Homeland Security Grants. The city gets an annual award, and it dates back to basically 2001, so post 9/11. But the city has received the largest allocation out of any municipality going back all the way to 2001.
Okay. And then in a paper today, and I knew this because I was at the National League of Cities over the weekend, but it looks like the mayor's office has gotten some of the money, $174,000. Is that something, $174 million, is that something that you were involved in, or is it other agencies that have now gotten the paperwork together, for lack of a better word?
So we're involved so far as we provide all of our information and spending contracts, all of the backup materials to OMB as it relates to our support for asylum seekers. As far as the actual application of the funds, as you're well aware, the city spent $4 billion and we're getting $174 odd million. And so those costs are primarily going towards the agencies that have a larger portfolio around the sheltering. So I defer to OMB on the specifics, but my understanding is it's going to HPD, H&H, Department of Homeless Services, or the ones that are doing a much larger portion of the sheltering operation.
Okay. And then maybe you said this, but what's your capital budget? I think you mentioned that you have to buy certain things, but what's your capital budget?
NYSEM does not have a capital budget.
You have no capital budget. Because you mentioned that so when you have your vehicles and so on, that's through DCAS?
That's correct.
All through DCAS. Everything is through DCAS. All right. And then just one quick, how many sites do you have now? I know I should know this, but how many sites do you have now? Obviously, Lincoln.
Yeah, so we currently have...
I know Lincoln. Thank you for that tour, by the way.
Yeah, absolutely, absolutely. We currently have 4 respite sites operating. We have one of the overflow sites, and then we have the reticketing center.
Okay. And then, I'm sorry, one more question. So all the mosques haven't paid their Con Ed bill. Who's in charge of that?
That's HRO. That is well, when you say all the mosques, I assume you're talking about
because they're leaving your St. Bridget's, I'm just saying.
Yeah.
And they don't have a place to go, so they're going to the mosques. So my question is, now the mosques can't pay the Con Ed bill. It's in the papers, it's discussed. I'm just trying to figure out who's going to pay. I'm not saying it's you, but I'm just wondering if that's something that's discussed.
So if it's the contracted sites, that's HPD and HRO.
It's not contracted, it's no place to go sites. It's the, I would say, illegal guests who have no place else to go.
Right. I'd have to learn more and look into to find out more.
I'm just letting you know it's a big problem.
Okay.
Yeah, I would just say one thing, which Zach was referencing. HRO, working with HPD, does have a contract with New York Disaster Interfaith. There are several shelters, and they have some overflow sites. And they are always looking for more, because obviously they have other, food pantries and thrift shops and different things that can help the asylum seekers. So if there are organizations, mosques, any house of worship, we should work to put them in touch with NIDIS and HRO, because they do receive funding to help with things like Con Ed.
I'm obnoxious, I know that, but I already know that they're not going to fit into that criteria. They don't have the sprinklers.
But there are things, there are hospitality sites during the day, there are the overflow sites, there are a classical shelter, yes, there are very stringent, but there are other possibilities. So I wouldn't say never, I would say let's talk.
All right, thank you.
I would just like to say that Councilmember Riley has joined us, and I will now yield the floor to Councilmember Schulman.
Thank you, Commissioner Fiscal, and you've done a great job, I have to say. And I remember when we toured the migrant center out at JFK. So, but just so you know, Christina's one of my peeps. So, New York City Healthy put out today that March is Severe Weather Preparedness Month. So the prediction is that we're going to get really bad hurricane season this year. We haven't really had any huge storms since Sandy of that nature, but the possibilities are increasing as climate is changing. So I wanted to know what kind of preparations that you guys are making.
Yeah. So first off, right now we are working very, very closely with the National Weather Service to look at the seasonal outlook. And this is really where they and the Hurricane Center start to ramp up a lot of the work that they do in preparation for hurricane season. Yes, this looks to be a more active season at sort of initially, but we always anticipate it being a more active season. And so one of the things we start to do is as we get the seasonal outlook, we start working with our interagency partners, our federal and state partners, private sector partners. We start running exercises. As you know, the coastal storm exercises or the coastal storm plan is probably our most complex plan. There's a lot of work we go into educating the public around knowing your zone, around having an evacuation plan, the public messaging piece. So that all starts in the lead up to hurricane season, which will start on June 1st.
Okay, I appreciate that. And do you have folks that go out to the different communities and do like forums, seminars, that kind of thing?
Yeah,
around
absolutely. So we do, we have a lot of training that we do. We have a lot of community engagement programs that we do. And then one of the things we are most excited about is we have our Strengthening Communities program. And so this is a network of community-based organizations. We currently have 35 networks across the city. Last year, we did some great work with them around flood preparedness, because as you know, there's sort of two types of floods that we need to prepare for. There's coastal storm surge from the ocean. There's also cloudburst, flood from rain, which is much more difficult to predict and to prepare for. And so we do a ton of work with the Strengthening Communities program to prepare communities as well.
And you work with DEP on some of the, like, there have been floods in my district in Forest Hills. Congresswoman Grace Meng got some monies from the federal government around that to help with that, so you coordinate with DEP on that.
Yep, and the mayor's office for climate and DEP with Mayor Joshi and her team at the Deputy Mayor for Operations Office, they're spearheading a lot of those efforts around infrastructure improvements.
So from a budget perspective, I'm just curious, so when you guys put in for FEMA money, does FEMA owe us any money? Or they're paid up on things that...
In terms of what, post-disaster? Or,
yeah.
Not always. You know, it sort of, it varies, right, as to what's the level of damage, whether we have had a declaration, whether we hit certain thresholds. So it really varies based on the emergency. And then, as you know, it can take a long time for FEMA to distribute funds.
If there's anything we can help with to talk to the congressional delegation or anything like that, because, you know, money is hard to come by now, especially, you know, moving forward into this budget season. So if we can help to pull down some of that money, we'd like to be helpful. So please let us know.
I would love that.
If there's something specific around that.
Can I just add two things?
Yes.
First of all, as Zach was saying, everybody remembers Hurricane Ida. There was a declaration the city did receive, you know, a share of money after that to work on mitigation. So we're doing programs around Notify NYC, around canvassing, weather forecasting. We're just one piece, obviously, of the whole city, but that money is coming into our budget now, strengthening communities. And the other thing I wanted to mention is with every emergency, obviously we learn, we pivot, there always is a silver lining. One thing I would say about asylum seekers is, as you noted, we haven't done large sheltering operations, feeding operation, all of those things since Sandy. You know, and most people have turned over in the last 12 years. So, you know, we've been using our emergency stockpile to bring out the cots and blankets and all of those things. We have been trying new food contracts. We have a lot of city volunteers. They're volunteers in that they volunteer to do the work. They are paid. But that are amazing in our sites doing language access, helping with, you know, just different things along the way. And so, you know, we've been looking at our assumptions, what's changed, what's worked well, and we are able to, because that's really the most helpful when you have an actual emergency and you can test your assumptions and what worked and what didn't and what's changed since Sandy. So we're taking all that information in the off season and putting that into our hurricane plans, and that'll make the program that much stronger.
Yeah, Chair, can I just, a couple of different, so one I wanted to mention, you know, all of us give discretionary monies to folks in our district, to CBOs and all of that, some of which are food banks and things like that. And if there's a way to maybe coordinate what we're doing with what you're doing so there's no overlap and we can be helpful, because I'm not clear on, I mean, I know they do a lot of work, the food banks in my district, but I don't know how many, like, are for migrants, how many are for, and so if there's a way to do that, I'd like to partner and figure that out. The other question, very different, is, so Notify NYC, the app, have you had an increase in people signing up? And also, can we help in terms of, like, just especially for these months that are emergency months or whatever, that we can get the council to put out, like, hey, like, please sign up and all of that?
We have seen a pretty significant increase in signups for Notify NYC over the last couple of years. We can get you those exact numbers in terms of the growth in subscribers, and we would absolutely welcome your partnership. In particular, one area that we are certainly always looking for help is reaching non-English speaking New Yorkers, right? It's available in 14 languages. I think one of the things that internally we're always talking about is that a vast majority of those subscribers are English speaking. and how do we really get folks that speak the other languages to sign up. Can be very difficult with some of the immigrant populations, non-English speaking populations, but would welcome your help on both fronts.
Yeah, and I just want to mention, so I'm working with Commissioner Vossen on Healthy NYC, which the council codified and all of that. We're going to be going around talking to different stakeholders in different communities, so as part of that, we can add that to the equation as well.
Great. We'll get you some materials and more information.
All right, thank you very much, Chair. Thank you very much, Commissioner and Deputy Commissioner.
Thank you. Councilmember Riley.
Thank you so much, Chair, and excuse my tardiness. I had a school visit today, so that's why I'm late. I did have a bunch of questions for FDNY, so Chair, just hoping I could send you those questions so I could get those answered. Commissioner, thank you so much for being here today. A few questions really focused on flooding. I have a lot of, my district is built around a lot of ponds, lakes, and rivers. So we do experience a lot of flooding when it rains very heavy. The mayor did put a plan together, the low interest disaster loan plan, that just, I believe, applications were until September 4th of 2024. Unfortunately, it doesn't say on the site that the Bronx is included in this plan. And we do have a lot of homes in my district that are experiencing a lot of flooding and damages during this time. So I don't know if there's any future plans to include the Bronx. Do you have any catchment areas that you're paying attention to in the Bronx? If not, we'd love to invite you out to speak to some of the homeowners that are experiencing this.
Yeah, so first off, would love to go out and speak with the homeowners. We do have catch basins in areas that are high priorities areas throughout the Bronx that we pay attention to. Depot Place is always one of them up there, but there are a number of others. We've had a number of rain events recently where we had greater impacts around the Bronx River as opposed to other areas around the city, especially when you have higher amounts of rainfall or precipitation upstate, snow melt, that can then cause greater inundation. And then in terms of the program, I would welcome a meeting and to talk more about that and ways that we could support your residents and your community up there.
Thank you. I really appreciate that. And the last question, there has been a lot of, according to asylum seekers, there haven't been a lot of illegal, I guess, locations where people are hosting asylum seekers. I believe I have a few in my district where people are utilizing homes. I even had one house in my district that had a sheet in front and was housing asylum seekers in the front yard. So is there any continuing plan to do outreach to see if these are possible sites that maybe you can look to house them? Or I just want to know what the administration's plan is on that.
Yeah, so we've now opened up, I think it's over 210, I think it's 215, 217 emergency sites across the city. As the mayor's made clear, we've now taken in over 180,000 asylum seekers that we provide services to. Of that, I think we're very proud that only about 68,000 remain in our care, and a lot of them, the vast majority, have taken the next step in their journey. In terms of those sites, we're always willing to look at other sites. The city is not opening up many new sites, but we're always happy to take a look at things if you want to send us places to look at.
All right. Thank you. Thank you, Chair.
Thank you. I want to address artificial intelligence. So in the November plan, it included pegs for $250,000 in the out years for software. And I'm not going to pretend to pronounce the software's name. The software provides real-time AI detection of high-impact events and emerging risks from within publicly available data. How does NISM intend to use this software?
Yeah, so we currently use Data Miner. It's just Data Miner, and it's a software platform that, and most of the pegs, correct me if I'm wrong here, Chris, it was around, we have a lot of seats that we don't need to use, and then there are also seats that are used by other agencies that we wanted them to pay for the seats that they needed, but we sort of did an audit of, do we need all of these seats for the Data Miner platform? And that was driving a majority of that peg. We use this software really to maintain awareness of events that could impact city operations. It's a system that basically monitors information that's out there in the public, X, I guess, not Twitter is what it's called now, different messages that are out there, news alerts, and then it sort of collects that and provides an alert to our team in watch command so that they have a way of monitoring what is going on. Sometimes it's very accurate, but it at least gives them a signal of something that they need to pay attention to and look and then confirm if it's something that we need to respond to.
Okay. And do you think that's 250,000 that can be used elsewhere better than?
So it's an important part of our response, but in terms of, look, we're always looking for places to save money, and if we can reduce the number of seats that are used, we will, you know, and especially, and that's one of the things we talk to our agency partners who also rely on it, you know, do they need all of their seats, or we can reduce the number of seats that they are also using.
Okay, and I just have two questions on Floyd Bennett, believe it or not. So we did see an evacuation for the wind incident that took place, but since then we have not had winds as high as 67 or 68 miles per hour. But we did have serious flooding there, and I just wonder why flooding is not considered a reason for evacuation of Floyd Bennett, since the flooding, you know, was upward of 2 to 3 feet, and it had breached the parameter of the base camp. And what I thought to myself was, this is a weekday and children have to get off to school. How are they getting to the roadway if they have to walk through 2 feet of water? So just wondered why water is not considered a points of evacuation for a place that is a flood zone and a base camp.
Yeah, it's a great question. So the elevation of Floyd Bennett Field, believe it or not, is higher than you would expect. And so the concern, what you have seen out there, what people have seen in terms of flooding, is really just rainwater. It's not coastal storm surge. The big concern for that area is if we had models showing an inundation of water coming in from Jamaica Bay or from the ocean. That's the type of thing where we would evacuate for a flood. But that is not something where we have had a forecast as of yet. We could during hurricane season, you know, if we had a zone 2 evacuation, that's something that we could do. But in terms of the actual water that we've had out there, it's really just been rainwater. It has not been coastal storm surge. Now, sometimes that has coincided with times where we have had significant coastal storm surge in around like Howard Beach, Brighton Beach, Broad Channel, where you also had heavy rains, but really all that you're seeing out there is rain, which is not a danger, not a big issue. The way they built that airfield, they really knew how to build things back in the day, but it's crowned, and so the way that it's built, the water runs off and onto the sides, and so there was never any impacts to the structures out there. It was never an unsafe condition. Whereas if you have, you know, huge tidal waters coming in from the ocean, that is a very dangerous condition, but we have not seen that, and it is higher elevation than the surrounding areas by design.
I have no further questions. If my colleagues have any further, then thank you very much for coming in.
Thank you all so much.
I appreciate you, like Councilmember Schulman said, and then the Councilmember Brewer, that you are always available, and we appreciate that, whether it's texting or calling or on the street, you know, boots on the ground, as they say. You're always there, and thank you very much. I appreciate that. We're going to go to the public portion of our meeting right now, our hearing. So would Nancy Carbone please come forward?
And then we have someone online to talk about the promotional, EMS promotion of the thing. Or not the EMS, the fire-
Lieutenant.
Lieutenant one.
Yep.
So you can go to him.
Thank you so much for coming in person.
Also, after in-person testimony, we'll be hearing from Doug Adams, who's on Zoom. So Doug, if you're available, please be ready to stand by. Thank you.
Do I hold it while I speak? No. Thank you. Just wanted to be sure. My name is Nancy Carbone. I'm the founder and executive director of Friends of Firefighters. I started Friends of Firefighters immediately following 9/11 attacks. The firefighters, I went to a local firehouse to see what I could do, like many people did. I can't cook, they would have gotten sick. I don't have money, so I couldn't give any money. And they started giving me different tasks. We need bunting for the firehouses. They needed a bugler for the funerals that they knew were coming. And then surprised me, he's the firefighter that I met with, John Sorrentino, right across the bridge at 205, said we're going to need counseling. And that surprised me because my great uncle was killed line of duty. These are strong members of the fire department that don't look for counseling. The counseling comes usually as a mandate 20 some odd years ago. So I was surprised, and I did what they asked me to do, and around Christmas they asked if I would get a counseling center outside of the fire department because they felt that it would impact their careers if they went there. They didn't want the other members to know that they were getting counseling, but they were struggling with what they had experienced at that time at the pile. As Ground Zero started to be dismantled and then rebuilt, the firefighters supported me in building a center across in Red Hook, across the river. They came from Ground Zero to build this, so that to me really did say that they need the help if they're going to build it themselves. It grew slowly. The fire department did not want me to do this. I don't have, my husband is an artist, so I felt, well, they can't fire me, they can't fire him. This is what the firefighters want, so I was very dedicated to it. I'm so proud to say that now, 22 plus years later, the fire department thinks what we're doing is fantastic. They actually have called and asked us to help them with situations. The counseling services unit of the fire department are sending us firefighters, family members, and so is the medical office. So we're a victim of our own success. We didn't know this would happen, but I will tell you that it doesn't seem to be slowing down at all. We have a 307% increase in use of our services from 2018 till now. I think a lot of it is COVID. I think a lot of families have been impacted so devastatingly that we're seeing trouble with the children. So we do see children, we see active and retired firefighters, and we have to see their families, because if you're not helping the families, you're really not helping the first responder. So they have a very heavy load, as you're all aware, and I thank you so much. I should have started with the thanks. Thank you so much for allowing me to sit here. But also thank you for your support, because you understand what the first responders go through. We're independent from the fire department, and while they do call us in, we do not share any information. And to make it more comfortable, I think, for the first responders, we operate out of an old firehouse that's privately owned, not by us, unfortunately, in Red Hook. During Hurricane Sandy, we were flooded. We had about 4 feet of water, which I took on as a challenge. And I was so silly, I just said, oh, we're going to be back tomorrow. What we did was we sort of abandoned the firehouse and we went to the affected areas. And over the next week or two, firefighters came in their own RV from Michigan, Texas, mostly New Orleans, and they wanted to volunteer. I went out and got 14 bunk beds, and we became a center where we would deploy people 28 at a time. So we pumped out over 110 houses in Breezy, in Staten Island, in Garrettson, you name it, we were there. If it was wet, we were there. And we split up the groups. And as a result of that, the fire department started to look at us differently, because we don't have the restrictions the job does. We're able to have our counselors nights and weekends. They're not. We're able to cross lines that they're prohibited from. So they, I think, saw our value then, and now they're calling us. And We don't take money from the fire department because I will not exchange identities of who comes to us. So I didn't want to get into a relationship where we would then have to give them information. We do not accept Social Security numbers for that very reason. In the very beginning, we didn't even get names. We got chicken scratches. I did the 4 scratches and a line through. So what we are now is we're operating very successfully, so successfully that we're, it's like, we need money so badly. And the reason why is that we're trusted. We operate out of the firehouse. The firefighters are very involved with this. We have what's called the kitchen table and the kitchen talks. They come for breakfast. It demystifies the process of counseling, and they're comfortable. But better than that, they're going back and telling the others that they should take advantage of this. We're hoping to expand to EMS, but without securing the financial backing for what we're already doing with Friends of Firefighters, we cannot launch our what we call Star of Life program that will be dedicated to EMS. With funding, we'd be able to do both, and that's what we're hoping to get.
And you have applied?
I'm sorry, say again?
You, of course, have applied for funding.
Oh, heck yes.
Oh, heck
yeah. Joe's been working on this like constantly,
Oh.
and I have as well, but I just want to say over the years we have gotten funding from the City Council, and it's made all the difference in the world. It's kept our doors open. But now the demand is so high that I'm asking that all of you help us to stay open and grow with them because the need is really tremendous. The other thing is I wasn't here before, Joe was, the ion batteries, that's a whole nother way of firefighting, and that's a whole nother thing. We also have the 9/11 cancers. So these are new challenges for our fire department. And I know that you're very well aware of them, so I won't go into it.
100%. And I thank you for your testimony and for the good work that you do.
Oh, it's an honor. Thank you very much.
Thank you.
Next, we'll turn to Doug Adams. Doug is joining us on Zoom. Doug, are you present? I see you've...
Hello?
Hello. You may
Hi,
go
how are
ahead.
you?
You may begin.
Thank you for your time. My name's Doug Adams. I'm a board member of the Exam 569 Lieutenant Eligibles group for the fire department. We just want to jump off what Mike Tracy said earlier. The delay in promoting off the exam has caused a staffing and public safety, in turn, a public safety crisis for the city. So what we're asking for now through the board here is if we can graciously and expeditiously ask the mayor to make a decision on the promotions and the list. We can't really go any further until he does. And if we could, as I said, respectfully ask him to make a decision. We've been waiting at least 6 months for this. And Councilwoman Ariola, thank you for all your help. And if there's any questions, I believe you have the contact for our group. Thank you.
Thank you for your testimony, and I just would like to let you know where we are on that, because this committee is very involved in that particular promotional exam and making sure that lieutenants are promoted. And we have spoken now directly with the mayor, and we are awaiting a response. And we all want the same resolve: the mayor's office, the fire department, and our committee, and of course, you as a person who's on that eligibles list. But it has been brought directly to the mayor, and we are awaiting his response. We thank you for your service. Thank you.
Thank you.
If there's anyone else from the public or online that wants to testify, we're going to leave the hearing open until 1:15. Thank you so much. Thank you, everyone who testified today. We're confirming that there are no other public speakers in the chamber and on Zoom, and this concludes the Fire and Emergency Management budget hearing for today. Thank you all.